That's going to do it for us tonight. Now it is time for the last word with Ali Velshi filling in for Lawrence tonight. Good evening, Ali.
Good evening, Rachel. Have a great weekend. We'll see you on Monday. Just ahead, is the president trying to, quote, incite division in the midst of a global pandemic? That's what a growing number of Democrats believe after Trump supported anti-lockdown protests in Democratic-run states. I'm going to discuss that with Michigan Congresswoman Debbie Dingell. She is from one of the states that Trump is calling on to liberate. Plus, hospitals and state officials say they don't have enough supplies or funding to ramp up coronavirus testing, and the president has all but refused to help. What Trump's refusal is going to mean for fighting this pandemic, and at the end of this hour, some potential good news to report. We're going to show you the promising data on a possible treatment for coronavirus patients. But let's begin with tonight's numbers. The numbers of deaths linked to coronavirus worldwide has now passed 151,000. As of tonight, there are more than 2.2 million reported cases of coronavirus around the globe. And here in the United States, there are 698,366 known infections. 36,559 people have died from coronavirus in the United States. And as the numbers continue to climb, Trump is looking to blame anyone but himself for the disastrous federal response to the coronavirus pandemic. And who better to blame than the officials who often stepped up when the federal government let down its citizens, the nation's governors. In a series of all-caps tweets, the president tweeted, "Liberate Michigan, liberate Minnesota, and liberate Virginia," 3 states whose Democratic governors have issued stay-at-home orders. 42 states in total have issued stay-at-home orders, and now those governors are doing their best to keep the coronavirus from spreading in their states. But instead of supporting the governors, Trump sided with protesters who've been pushing back on those and how effective efforts to stop its spread are working. But the president is almost nowhere to be found on the testing issue. There's no national plan for testing Americans. Let's make that clear. There's no national testing plan in place. The Washington Post reports, quote, "Trump's buck stops with the states posture is largely designed to shield himself from the blame should there be new outbreaks after states reopen or for other problems," end quote. So far, about 3.5 million people have been tested in the United States. Now, that's a significant improvement from early testing stumbles, but it's still far short of the millions of tests per day that experts say is needed to begin safely reopening the economy. And some leaders are now at their wits' end. Quote, "a dereliction of duty." That's how independent Senator Angus King of Maine described the lack of a national testing plan on a phone call with Mike Pence and Democratic leaders. New York Governor Andrew Cuomo also went on the offensive on the testing issue.
Don't ask the states to do this. It's up to the governors, up to the governors, up to the governors. Okay, is there any funding so I can do these things that you want us to do? No. That is passing the buck without passing the bucks.
Minutes later, Donald Trump hit back, tweeting, "Governor Cuomo should spend more time doing and less time complaining. Get out there and get the job done. Stop talking." Now, he tweeted this in the midst of Cuomo's press conference, and a reporter read Trump's tweets to Governor Cuomo. And his response typifies the frustration that many officials at the state and local level are feeling with the federal government.
First of all, if he's sitting home watching TV, maybe he should get up and go to work, right? I don't know. What am I supposed to do? Send a bouquet of flowers? The only thing he's doing, let's be honest, well, it's up to the states to do reopen. By the way, it was always up to the states. What are you going to grant me what the Constitution gave me before you were born? It's called the 10th Amendment. I don't need the President of the United States to read the Constitution for me. Maybe he should have read the Constitution before he said he had the power to open the states.
All right, what's maybe most remarkable about Cuomo sounding off is What didn't happen next? President Trump didn't respond. He didn't tweet. Might some of the governor's remarks have hit a little close to home? Well, it's hard to say, but we couldn't help notice how unusual that kind of response is for Trump. Of course, the back and forth between Cuomo and Trump isn't just a war of words, it's a war of ideas. Ideas about who is responsible for the lives of Americans. When should states take charge, and when should the federal government step in? It's critical that there's a unified plan of action right now. The less cohesive a plan is, the greater the chance of a resurgence of the virus. And we stand all the more likely to see a second surge of coronavirus in the United States the longer the states and the federal governments are at odds over how to combat this pandemic. Maureen Bittinger-Grisius is a nurse at Beaumont Hospital in Michigan. She's been keeping a video diary of her experiences in treating COVID-19 patients. In one entry, she described her fears of a second coronavirus surge.
I think my biggest fear, of course, is another surge. Those first couple weeks were a war zone. And that's not the case right now. I feel confident in that our health system is able to continue to accommodate patients at this rate. But a second surge, I don't know what that would look like, and it would be devastating in so many ways.
All right, leading off our discussion tonight, Ron Klain, former senior aide to Vice President Joe Biden and President Obama. He served as the Ebola czar during the Obama administration. And Nicholas Kristof, a Pulitzer Prize-winning columnist for the New York Times. He's been covering the coronavirus pandemic and recently went on the front lines inside two New York City hospitals that are treating COVID-19 patients. And Nick, I want to start with you, and I want to start there, because that's where this battle is being fought. Donald Trump thinks he's in a battle with governors and talking about liberating states, but the real fight against coronavirus is going on in these hospitals where they continue to be short, in some cases, of protective equipment, where people are working multiple shifts. What did you see when you went to those hospitals?
Well, boy, I should say that, I would love to escort President Trump into some of these hospitals, and I think he might have a somewhat different tone if he did visit them. The two hospitals that I visited were overrun. They were overwhelmed. The staff is completely heroic. They don't have good tools. They've been trying things like hydrochloroquine. They have not been terribly effective. Intubation and ventilators likewise have not been terribly effective. And so the doctors and the nurses, the respiratory therapists, they go around every day. They're scared. They're not sure that their PPE is adequate, and they're reassuring patients. They're assisting them. They're encouraging them. And one young doctor told me that she goes home at night and then cries because she isn't able to do what she was trained to do, which is to save lives. And to see that kind of heroism and their determination to do everything they can to save lives. And then, they described feeling like they were let down by Washington, which wasn't attacking the problem with the same determination.
Ron, these, even in Ebola, in any of these things, the nurses, the doctors, the frontline workers, the EMTs are the heroes. In Ebola, we thought we had lost that nurse in Dallas, and she was sent to the Washington area on an airplane. I remember the whole nation watching that. So we know that they're the heroes. But what we didn't have during Ebola was this nonsensical battle going on between Donald Trump and certain governors. Donald Trump knew the other day when he said it's his decision to reopen the country. I mean, I don't know if he's read a pamphlet about the Constitution, let alone the Constitution, but he would have known that wasn't within his power. It does seem like every 48 hours or so, the president decides to embark on a fully counterproductive endeavor rather than work with the people who are fighting this disease.
Yeah, Ali, it's a great point that President Trump the other day asserted powers that he doesn't have, powers to shut down and open the economy. But he's not exercising the powers that he does have. That's the powers to get the medical equipment to the kind of people Nick saw working in New York and are working in hospitals all over this country right now. They deserve face shields. They deserve the appropriate protective gear. They deserve the gloves and gowns that will really work And, that was something we did during the Ebola response. We took control of the supply chain. We got that equipment where it needed to get to protect the people on the front lines. And the fact that we're not doing that is a double tragedy, Allie. And the first tragedy is the human tragedy that Nick reported on, the horrible impact on our doctors and nurses, respiratory technicians, all the healthcare workers in the hospitals. But the second is we're going to see these healthcare providers get sick at the moment we need them on the job. We should protect them because it's the right thing to do. We should protect them because it's the smart thing to do if we want them to take care of us when we need medical care.
Nick, we're not mathematicians, nor are we scientists or medical people, but one thing we know is that determining the rate of infection and determining the mortality rate are based on a denominator, and the denominator involves understanding how many people have this infection, and unless we test enough people, we don't know that. And if we're talking about reopening the economy, we have to be able to test to see if people have the antibodies. Dr. Fauci was asked about this at the White House briefing today, and Fauci, again, I don't know how he stands there next to the president, because he always has something to say that it seems to be at odds with that of the president. Listen to what he said to us.
I want to make sure people understand that not to underestimate the importance of testing. Testing is an important part of a multifaceted way that we are going to control and ultimately end this outbreak.
But ultimately, Nick, this is weird because from the beginning, this has been the thing the president's been fighting about. He used to say anybody who needs a test could get a test when we had evidence that wasn't actually the case. We'd have doctors on our shows saying we don't even have the materials for the testing. We don't have the swabs that you put in people's nose to undertake the testing. We don't have the ability to meet the criteria to have testing. Here in New York City, if you're not sick enough to get hospitalized, you weren't able to get a test even if you had the symptoms of coronavirus. Something this basic is holding us back. We're not going to get a handle on this thing, and we're not going to be able to get to the White House's phase 1, 2, and 3 to reopen the economy unless we can ramp up testing, and it's befuddling that we can't.
Yeah, and I mean, look, this is hard, and I don't think that many people had anticipated the shortage of swabs, for example, or of reagent. But the need for tests is one of the most basic things that people were talking about in January. And, there is a legitimate debate now about how we reopen the country, to what extent we can reopen schools in some places. But that depends on our understanding of community transmission in those cases. And that, as you suggest, is going to depend on a large amount of both diagnostic testing and also serological testing to determine antibodies. And right now we have virtually no capacity to do serological testing in any significant way, and we probably need 5 or 10 times as much diagnostic testing as we have. And so, when the president talks about liberating these states without giving people the tools to actually figure out what they can do, that's not policy formation. That's policy vandalism.
Policy vandalism, indeed. Ron Klain, what, if anything, has to happen now? Fauci keeps on, and other people keep on saying, reopening the country is not a date certain thing. It depends on where the virus is and how it's going. The president has now capitulated to the Constitution and told governors, it's in your hands now. It does become confusing in a matter of this magnitude to not know who's in charge and when we are getting back to work.
Well, of course, there should be clearer science-based leadership from Washington. But I think the president's made his intention very clear. He sent the signal to his supporters. He sent the signal to allied governors in red states. They should just reopen as soon as possible, without regard to testing, without regard to the state of the disease. I mean, that's essentially what he's saying when he tweets out, liberate Minnesota, liberate Michigan, liberate Virginia. It's essentially what he's saying when he basically makes it clear that he's not going to get the testing in place. Without testing, we are opening blind. The president needs to fix that.
Worth noting that more Americans died from coronavirus yesterday than during the entire Iraq war, and we haven't got a handle on this yet. Thanks to both of you, Ron Klain and Nick Kristof. Coming up, we're going to take a serious look at the state of coronavirus testing with two doctors, how the Trump administration failed early on and is still failing states, and what needs to happen now for the United States to succeed. Well, there's one thing that experts agree is key to getting back to life as we knew it, and that is testing. Only about 1% of Americans have been tested for COVID-19, and testing has plateaued at an average of about 150,000 tests daily. Take a look at this. Countries with populations of more than 5 million and where we stand. But public health experts tell NBC News that testing, quote, would have to be at least doubled or tripled from its current levels to allow for even a partial reopening of America's economy. Without diagnostic testing on a massive scale, federal, and state officials and private companies will lack a clear picture of who has been infected, who can safely return to work, how the virus is spreading, and when stay-at-home orders can be eased. Now, hospitals and state officials say they don't have enough supplies or the funding needed to substantially ramp up their testing, and Donald Trump has refused to help. New York Governor Andrew Cuomo voiced frustration about the lack of coordination from the Trump administration today.
He said 11 times, I don't want to get involved in testing. It's too complicated. It's too hard. I know it's too complicated and it's too hard. That's why we need you to help. I can't do an international supply chain. He wants to say, well, I did enough. Yeah, none of us have done enough. We haven't, because it's not over.
Joining me now, Dr. Zeke Emanuel, former Obama White House health policy advisor and an NBC News and MSNBC senior medical contributor. And Dr. Richard Besser is the president of the Robert Wood Johnson Foundation. He was the acting director at the Centers for Disease Control, where he coordinated the response to the H1N1 virus. Dr. Besser was just named by New Jersey Governor Phil Murphy to serve on the multi-state council to reopen the region's economies. Welcome to both of you. Thank you for being with us. Dr. Zeke Emanuel, you have been talking about testing. We've been talking about this on MSNBC for several months now, and you have been talking about testing because without the testing, other things don't fall into place. You cannot understand rates of change. You cannot understand rates of infection. You cannot understand rates of mortality, and you can't understand what's working and what's not working if you don't know who's got this infection.
That's absolutely right. We're testing, as you pointed out, 160,000 cases. The minimum experts say is 500,000 tests per day. I've estimated that we probably need around 2 million to start with, and we'll need to expand. As we open up more of the economy, we'll have to test more people going back to work and who are interacting broadly with the public. The problem is that the CDC recommendations for testing are still heavily focused on people who have symptoms, trying to diagnose people who have illness. What you need to open up the economy is to diagnose the spread of the disease, and that means you need to diagnose people who are intersecting with lots of other people. Frontline healthcare workers, frontline transit workers, bus drivers, people in grocery stores, people, police officers. When you add all those people up, you quickly come to we need to test 7 or 8 million tests per week just for that group. Forget patients, forget people who are intersecting, and you want to make sure that they're not spreading the virus like that woman who had a 40th birthday party at that 40th birthday party in Connecticut, or the Biogen meeting in Boston. So you need to test a lot more people. And this idea that all we need is 4.5 million tests a month is ridiculous. That's if you want to focus on symptoms, but we want to focus on limiting spread, and that requires many, many more millions of tests per day and per week than the government has predicted. And by the way, that, as you point out, Ali, that's only step one. That's not the whole chain of what you need to do to open up the economy.
Right. It's the basis, but it's the basis, unfortunately, that we've been arguing about or jostling about for a long time, and it is the thing we needed to do right in the beginning. Now, Dr. Bresser, there's some thinking that there are serological tests or tests that can determine whether you've had the infection. Maybe you thought you had it and you got past it, or maybe you were asymptomatic, but we should be able to, on a very, very large scale, get tests to determine whether or not you had that infection. Now, non-scientists, non-medical people like me would think, okay, if I get this thing and I get a relatively fast result and it shows that I have antibodies, meaning I had the infection, I'm good to go back to work. Is that naive?
Well, a lot more work needs to be done to determine what level of protective factors or antibodies in your blood would indicate that you're protected from future infection and that you've had this and are safe to go back to work. But I want to get back to that issue of testing and why it's so critically important. What we're talking about is moving from a strategy where everyone is social distancing to one where the public health system needs to identify people very quickly who are infected and sick, isolate them so they can't spread to other people, identify all the people they've come in contact with. That's called contact tracing, and it's one of the oldest methods in public health. And then get those people into quarantine. That means isolated from other people so they're not able to infect people if they become sick. That kind of strategy can prevent the big outbreaks from occurring when we start to loosen some of the social distancing measures. And it would mark a dramatic shift in the approach to this, but the one that would have to come for the next phase in responding to the COVID-19 pandemic. I'm not hearing you.
We're not hearing you.
We don't hear you.
All right, we're back. I hope everybody can hear me now. Dr. Richard Bresser is there, Dr. Zeke Emanuel, and you guys are out there. As you know, we're in a new era right now. We are broadcasting from our homes, and every now and then we get some technical gremlins into the system. So we are back. Thanks, gentlemen, for your patience. Zeke Emanuel, I want to ask you about this report that came out that suggests that there was a test that was conducted at the University of Chicago with an existing drug, and that 133 people were tested, and all but 2 have recovered from serious coronavirus. 2 people perished. What do you know about this test, and what should we make of it?
So remdesivir is a antiviral agent that works to disrupt the reproduction of the virus once it's in the lung cells. It was developed, about 17, 18 years ago by Gilead. Has never found a home for use. It's been tried in several different conditions. And there is has been some early data that it's promising and working. Now, the big problem in all these trials where you don't have a randomized trial setting and you don't randomize patients is what's called patient selection. Are you using this drug on some patients who are likely to do better and not on patients who are likely to do worse, or what other criteria subtly play on you? And so until we have randomized controlled data, it's going to be very hard to know whether net this drug works. And that, I think, is the major problem with evaluating all these studies. On the other hand, in this moment, the government is under huge pressure to get a treatment. And I might say we've been here before. It was hydroxychloroquine just a few weeks ago. That is, gone by the wayside. For lots of reasons, it didn't seem plausible. This may be more plausible. Let me say one other thing, though, that I think the viewers need to keep in mind. In viral infections like HIV, like hepatitis C, one of the things we've learned is that, one drug isn't going to work. You need multiple drugs to work at different stages. And in the case of COVID-19, maybe you need an antiviral, and maybe you need an immune modulating drug, or maybe you need 2 antiviral drugs. So it may work remdesivir may work, and it may be great. Your audience should remember it's not that easy to give. It's not a pill. It's an infusion. It takes 5 to 10 days, depending upon the regimen that people are using. This is not something for mass production. It may be good for people who are very, very sick to bring them back. But remember, you don't want to get a lot of people very, very sick. So it's not going to save us or open up, make it easier to open up the economy with, lots of people getting sick and then going in to get this drug, because that's a very poor way of operating.
And Dr. Bresser, there's news out of France that Sanofi, the drug maker, partnering with GlaxoSmithKline to produce what they say is 600 million doses of a vaccine by 2021. Now, vaccines are complicated things to develop, so I don't know if that's an entirely aspirational statement or that's a statement that says if we get the vaccine, we have the capacity to create 600 million doses by 2021. Mm-hmm. What's your understanding about what our timeline is to a vaccine?
Well, I like to be cautious when it comes to promising vaccines or drugs on a certain timeline. It's better to underpromise and overdeliver. There are many viral infections for which we've been trying for decades to develop vaccines without success. I worry that a lot of the announcements about vaccines and where they are in trials is more about stock price than it is about truly the likelihood those vaccines will make it through. These are vaccines that haven't been tried in people. One concern I have is that there'll be such public pressure and governmental pressure that vaccines will be given to people on a large scale without adequate safety testing. And we have the FDA for important reasons to ensure that all of the drugs and vaccines that are given to people are safe and effective. And we don't want to shortchange that process. We want to make sure that we're using public health measures to control this until we have safe and effective therapy. But let's not rush to vaccinate before we know we have something that truly works.
Yeah, I think you make a very interesting point, because yesterday afternoon, when the word of this Gilead treatment came out of University of Chicago, it was leaked out to a newspaper. The shares of that company shot through the roof, and it actually turned the stock market around. And I was thinking to myself, might be an interesting drug, but boy, did all of us who own stock suddenly become brilliant about medicine and infectious diseases. I think your caution is a wise one. Thanks to both of you gentlemen, Dr. Richard Besser and Dr. Zeke Emanuel. Thanks to both of you. Zeke Emanuel and I are going to be back right here next Friday night for a special Life in the Time of Coronavirus. We're going to focus on the science of this. We're going to focus on the medicine of this, and we hope you're going to join us. Coming up, Donald Trump isn't just failing governors on testing. Today, he was egging on protesters in some states to violate his own administration's guidelines on social distancing, putting everyone at risk. That's next.
If it makes people feel better to take their frustrations out on me, that's fine. All I ask is let's not get overly political here. There's a price that's paid, and I know that there are a lot of businesses and people that are hurting right now. But the fact of the matter is, it's better to be 6 feet apart right now than 6 feet under.
That was Michigan Democratic Governor Gretchen Whitmer this morning with an arresting visual about social distancing. Better to be 6 feet apart than 6 feet under. Her comments were in response to protests in the state capitol on Wednesday. Shortly after Whitmer said that today, Donald Trump tweeted, just 2 words in the tweet, all caps, "Liberate Michigan." Trump issued the same tweet scream about Minnesota and Virginia. During a conference call with the White House today, Senator Tim Kaine of Virginia, one of the 3 states Donald Trump called to liberate today, challenged Mike Pence about those tweets, asking why Trump was trying to incite division in the midst of a global pandemic. Of course, we all know why. All 3 states, Michigan, Minnesota, and Virginia, have Democratic governors, and all 3 states are swing states that Donald Trump hopes to win in November. And even though the protesters are clearly violating social distancing guidelines, putting themselves and others at an already overburdened healthcare system at risk, Trump is supporting them because
they seem to be protesters that like me.
Wow. there have been a series of protests popping up around the country featuring Trump flags and paraphernalia and hats. Here's video today from Orlando. Today, former Republican governor of New Jersey and former Bush 43 cabinet minister Christine Todd Whitman tweeted this. This president is now truly getting out of control. In talking about liberating the states, he's using language that could well lead to rioting. No one has done more to undermine our Constitution and destroy our country's values than Donald Trump. Joining me now, the former Republican governor of New Jersey, Christine Todd Whitman, and Congresswoman Debbie Dingell of Michigan. She's the senior Democratic whip and a member of the House Democratic leadership. Welcome to both of you. Thank you for being with us. Governor, you were a cabinet secretary. You're governor of a state. We have spent a week in which the president has said he's the one in charge in violation of the Constitution. He's then backed down from that and told governors they're in charge. And now he is feeding this idea that people should protest. There were people who went to the Michigan State House and protested next to each other, no social distancing, involved in this whole thing. What do you think is going on here?
Well, it's all about re-election. And that's the thing that is so extraordinary. This man plays politics with every single issue. And what we're facing today is much too important. There seems to be this idea that he is promoting that governors somehow don't want to reopen their states. They like this, particularly Democrat governors. That's the furthest thing from the truth. Governors, first of all, really feel the economic impacts. In fact, many of them have a constitutional requirement to balance their budgets. They're also much closer to their constituents than those who go to Washington and never come out. They care about their people and their people's lives, and they care about their economies. They want to reopen, but they want to do it in a reasonable way. And for that, they need the help of the federal government to get the tests and get the protocols that they require to be able to understand when it's safe and who can be next to whom. And to have a president undermine his very own words when he says, social distancing, and then he encourages people to go out and tweet. And frankly, his one on Virginia about free Virginia, protect the Second Amendment. What guns have to do with the coronavirus, I have no idea.
Yeah, and I think you make a really, really, really important point here. State governments cannot print their own money, and in many cases cannot assume debt, at least for operations. So for governors, having their states shut down is a very, very expensive matter. Congresswoman, your governor gets picked on by the president almost as much as the governor of New York does. Governor Cuomo seems to be his favorite punching bag, but Gretchen Whitmer is a very close second. He seems to have a beef with her and what she's doing. But to what Governor Whitman just said, she's following federal guidelines that are outlined by Fauci and Birx and the CDC and in the president's 15 days to recovery plan, which we're passed. So what do you think is behind this, and what are you worried about?
What I'm worried about is the politics and how we've got to dial this down. I'm living in a state that's still got high death rate today. We're still, depending which day it is, it's not a contest you want to win. We're the third or fourth highest state in the country with the number of cases of COVID. Right now, we got to worry about keeping each other safe. I've been in my house. Okay, everybody knows me. I'm not exactly a stay-at-home person. I have been in my condominium for 34 days. I have not physically been near another human being, which isn't. But I'm doing it because it's what we have to do. I have had more than 20 family and friends die in the last 6 weeks. I don't want anybody else to die. And that's why she is doing this. She's not doing it to make people feel like prisoners, which, quite frankly, many of us probably do. And I think we've got to, both sides, we can go back to campaigning in a few weeks, but let's work together to save lives right now.
Governor, again, you have been someone who's been a governor, and you've been a cabinet secretary. You've worked in government. It is really hard for us outside to understand what's going on in the White House and in the administration right now, because it does seem to vacillate from day to day. Once in a while, the president comes out and gives a press conference, and it's got stats, and it's got data, and it's got plans, and the CDC and Fauci and Birx seem to have a central role. And then other days, he goes strangely political and attacks people. For regular regular people out there who are watching TV, who are trying to get past this, they are looking for leadership, and they're very confused when their governors are fighting with their president.
I don't blame them. I mean, that's the problem, because the president does have the bully pulpit, and he gets the most press. So when he starts saying things that are contrary to what he said the day before, that just sows confusion in everybody's minds. The governors are trying to be reasonable, and that's why I think it's so good that you have those 6 northeastern states that have banded together. You have some of the Midwestern states have come together, and 3 of the Western states to say we're going to coordinate how we reopen and how we do this, because this coronavirus doesn't care about geopolitical boundaries. It could care less about one state or the other, and people travel between them. So it really is critically important if we want to get behind this so we can get back to the politics of an election year. But as the Congresswoman said, this should not be about politics and the president's reelection. And all these actions, this pivot from I'm in total control to no, actually it's the governors, but then don't pay attention to the governors in certain states, is all about politics. And that's just wrong right now.
And Congresswoman Dingell, you come from a state where not only does the shutdown affect you directly, but you have massive trade with Canada, and that border remains closed to non-essential work as well. Let me just ask you this, Congresswoman. We ran out of money for the $350 billion for small businesses yesterday. The president has dangled this idea of Congress adjourning. We may need 2 to 3 times the money for small businesses to keep their employees on payroll. What do you believe the next step looks like in at least staunching some of the economic bleeding before we get back to work?
We have to do 2 things. We should have late last week, have passed a bill to have gotten immediately more money into this program. I cannot, Ari, in the last 2 days, I've had more businesses. I probably had 100 phone calls between yesterday morning and this evening. I was still on the phone an hour ago with businesses and small restaurants that are just scared to death about what's going to happen. Michigan we were 35th in the country in terms of the amount of money that came to our state. There's a need. We need to get more money into it, and then we need to get busy on CARE 2 package. Tweak what was not great in CARE or is not work. The first CARE package, help it work. And we need to make sure that Americans across the country know that we know what's happening to them right now. They're afraid about their job. They're afraid if they have something to return to. How are we going to get the American auto industry going again? It's still the backbone of the American economy. And we ought to work to stimulate this economy when it's safe to go back to work. And how are we going to make sure we're safe to go back to work and workers are going to feel safe back at work?
These are good questions, and we are craving the answers to them. Thank you to the 2 of you for joining me tonight, Congresswoman Debbie Dingell and former New Jersey Governor Christine Todd Whitman. Thank you for joining us. Coming up, Black and Latino communities have been hit disproportionately hard by the health crisis caused by coronavirus, but they also stand to be very hard hit by the economic crisis. Up next, we're going to look at what's happening in the Latino community and how much of the federal aid is actually getting to them.